Hello and welcome everyone. This is Dr. Robert Shapiro with Shapiro Chiropractic. I am the president and founder of Shapiro Chiropractic Incorporated in Stockton, California. And today I'm going to tell you how to stop a headache naturally. Now, what causes a headache? There's many things that cause headaches. Typically, one of the most common types of headaches is what's called a tension headache. And this usually comes from mental or physical stress. Sometimes cold can trigger it, cause the muscles to tense up. The most common reason or region and problem area tends to be in the neck area, and specifically a region just below the skull called the suboccipital region. The skull is made up of several bones. This is the frontal, temporal, parietal, and occipital is in the back. Below that, the ridge, at the ridge below, just beneath your skull, is called the suboccipital region, and those muscles hold your head up and allow it to nod up and down. And they're very easily strained, and when they get strained, they develop what are called trigger points. Trigger points tend to cause pain. So what I'm going to show you is a simple, effective technique that doesn't take any more than about maybe a minute and can clear out probably easily about anywhere from 80 to 90% of headaches for you, just like that, without having to use drugs. And so this is an acupressure technique, and basically what you want to do is you want to take your thumbs and you want to go behind your skull, go follow down below it, start kind of in the midline, in the middle of the skull. Go down to that ridge and go just underneath it and apply pressure in and upwards. And then go along that ridge outwards until you find a tender point, and usually this will radiate pain up into your head somewhere, or it'll just be tender right there. And what you want to do when you find one of those tender points, you want to stop and apply steady pressure to it for about 7 to 10 seconds. And after 10 seconds, move on and try to see if there's any more pressure points that go all the way out to just behind the ears, okay? And then sometimes what you have to do this 2 to 3 times in order to clear these trigger points out. So you'll go back to the center line again and just come back out, find your tender spots, apply 7 to 10 seconds of pressure, move back out, do it a third time, move back out, and that'll usually clear those out. If it doesn't, leave it alone, okay? I'll tell you what to do next. The next set of muscles you want to work on are these muscles right here along your jugular line, or where your carotids are. This is called your sternocleidomastoid muscle. It's a very common headache generator, and it can also aggravate your sinuses. So what you're going to do is you're going to find that muscle. It's best to get into a mirror so you can see it. The side that you want to apply pressure to, turn your head away from that side, and that'll make it easier to find that muscle. You're going to apply pressure in 3 spots using a pinching technique. You'll start at the bottom, come just off the collarbone, come up, pinch it for about 7 to 10 seconds. After that, move to the middle of it, apply 7 to 10 seconds of pressure there. Don't worry, you won't hit your carotid artery. And then come up, and this one's a little tougher. There's one just behind your ear, underneath that little bony bump that's behind the ear. You're going to go just off of that, and that's where you're going to apply pressure. And sometimes you have to bend your head to that side in order to slacken that muscle, loosen it up, so that you can get some of that muscle in your fingers. And you're going to apply 7 to 10 seconds of pressure. And a lot of times if there's real bad trigger points, they will radiate around your ear and even into your eye. So many times you'll feel it in your eye. And so after you've cleared one side out, you're going to go to the opposite side, 7 to 10 seconds of pressure, 7 to 10 seconds of pressure, and finally 7 to 10 seconds of pressure. And if you do that, I guarantee you, you should definitely feel tremendous relief, and many times this will take care of a headache altogether for you. As I was saying, if you don't knock out the headache with 3 applications of pressure points, then after you've done this, take an ice pack and put it behind your head, kind of underneath that ridge, that suboccipital area, for about 10 to 15 minutes. and that should help get the inflammation down, and you should be feeling a lot better by then. Again, I want to thank you for coming to visit us, and we will see you again in another video.